When we're thinking about developing our teaching plan for our students, we often consider not just the learning objectives, but also what are our teaching strategies going to be to ensure that students are walking away meeting those objectives and ultimately meeting those outcomes so that they can feel empowered and competent to make safe patient care decisions. Welcome back, everybody, to Dr. Sellars at Educate. We're happy that you're back, and we want you to go ahead and print out the study worksheet if you haven't already. This is going to make sure you stay focused as we talk through these concepts today. All right, so these are also two other elements that we want to make sure you capture on your study worksheet. So first, you're going to write down the date, whatever date you're watching the snapshot. Second, we want you to write down what is one takeaway, what's one objective that you want to have achieved at the end of our time together, okay? And then last is think about what support you need to take you to that next step. Oftentimes when we're on the CNE journey, it can feel quite overwhelming. And we don't want you to feel that way. We want you to know that you have consistent support to help guide you in moving forward on your journey to ensure you're closing your knowledge gaps and you are using evidence-based practices in the classroom with your students. All right, so first and foremost, as always, we're going to start with our thought-provoking question. So here we go. You're going to see it right here in the description. A nurse educator designs a high-fidelity simulation involving a patient with worsening sepsis. During the scenario, the student correctly identifies abnormal vital signs and initiates the sepsis protocol, but they fail to recognize subtle changes in mental status and they delay escalation of care. During the debriefing, the student states, I followed the protocol, so I thought I was doing everything right. Which educator response best promotes the development of clinical judgment beyond task completion? All right, so we have three options that you see here. Remember that when you get to the CNE exam, there's going to be three options, okay? And this is for the CNE Clinical, CNE Novice, and CNE PV. So there are 4 CNE exams now that are available on the NLN website. There are 150 questions on the exam, and you have 3 hours to take the exam. Now, this is as of our current date that we're launching this snapshot. So this is May 2026. There may be changes that happen. And what you want to think about when you're reading the thought-provoking questions, when you get to the actual CNE exam, 2 thoughts. Number 1, what is this question really asking me? And second, what is it that I know for sure about concepts related to this statement? All right, so you're going to see these 3 options that again are listed right here in the description. A is reinforce adherence to the sepsis protocol and provide additional content review on early signs of sepsis to strengthen the knowledge gaps. B, guide the student through reflective questioning focused on interpreting, noticing, and prioritizing cues, linking mental status changes to clinical deterioration. C, repeat the simulation scenario with increased complexity to allow the student another opportunity to apply the protocol more. Oftentimes with our students, they may struggle with prior learning and struggle with being able to transfer that knowledge to a future situation. So what do we mean by that? If we teach sterile technique, you all know I like to use that example. So if we're teaching sterile technique and it's associated with a Foley insertion, they may not correlate that and align that with a dressing change. Okay, so we want to make sure students have this deep comprehension of concept that we need them to, and when it's a policy or a practice that they should be following, that they're able to actually demonstrate that skill in a safe way that's going to lead to alignment with exactly what the evidence says they should be doing. All right, so if you chose B as your option, give yourself a round of applause. B is the correct answer, guiding the student. We want to be that guide on the side. We want to be that coach, giving students feedback. And first of all, acknowledging the good things that they did, right? The good decisions that they made. And then we want to coach them specifically related to opportunities to do it better next time. Okay, so that's what we want to think about. How can we truly support our students by giving them prompt feedback, number 1, 2, meaningful feedback, and number 3, being there to coach them through those steps. as they reflect on what worked well, what didn't work so well, and what are they going to do differently next time. So just looking at that clinical judgment model. All right, now what we're going to focus on are going to be your specific strategies. This is the first part of our series, and looking at what are those tips, those strategies to help you achieve that passing score on the CNE exam. If you're on the journey to take a different exam, this is what we encourage you to still do, okay? We encourage you to look at the exam blueprint. So for the exams, the majority of exams in nursing, there are blueprints, just like even for the NCLEX. There's a test plan that really identifies at least the categories of concepts and teaching strategies, clinical practices that you should focus on in order to achieve a passing score. I encourage you all, if you haven't already, if you teach in a pre-licensure program, go to the actual NCSBN website for the specific exam. So if it's NCLEX RN, you're going to go to that NCLEX RN website with your students and encourage them to use that website, encouraging them to use those references, those resources that are explained on the actual website to help guide them in closing their knowledge gaps, hopefully decreasing their anxiety about the NCLEX exam. And oftentimes at colleges, we also have an NCLEX prep class, which is great. However, we want students to also start going to that website for themselves and using the excellent resources that are available. All right, so let's talk about strategy number one. Tip number one is self-assessment. Your ability to have increased knowledge of where your gaps are is essential as you're moving forward on the CNE journey. So what does that look like? Malcolm Knowles talks about our ability to be self-directed in our learning is part of the andragogy model, or the adult learning theory model. He says that when we are an adult, we should think differently than we did when we were children, right? We should engage in lifelong learning. We should also know and identify those resources that are going to help us close our knowledge gaps and be a better learner, be a better, for us, facilitator of learning to support our adult learners being able to have that deep comprehension of knowledge that they need to have in order to make safe patient care decisions. Okay, so let's talk about 3 different ways that you can conduct your self-assessment. So number one is going to be using that exam blueprint. So when you go to the NLN website, you will see that there are blueprints, and they are included in the actual handbook for all 4 of the CNE exams. In the candidate handbook, you're going to find the blueprint that lists out what those sub-competency statements are. You're going to then do a self-assessment. Okay, so this requires you to do to take a moment for a real transparent look at your specific behaviors and how they align with those sub-competency statements. I'll give you an example. With competency 2 for CNE, there's a specific description about educational theories and how we're expected to engage in demonstration of active teaching strategies, teaching and learning strategies to align with the educational theory. So if you feel like I have no idea what that means, then that's a gap area. The goal is you're at least 70% confident that when you get to the CNE exam, you could answer a question related to the concept that is listed underneath each of those competencies. There's 8 for CNE, and those are called sub-competency statements. If you don't feel like you're at least 70% confident that you could answer a question correctly on the CNE exam related to that concept, it's a gap area. And then the next step is you're going to start thinking about what resources you need to close your knowledge gaps. Now, our dominant resource, of course, is Billings and Halstead. Let me grab a copy. This is the 6th edition. The reason why we use this one is because this is the one the exam writers used back in 2023 when they wrote more exam questions and they revised the actual blueprint, okay? But the 7th edition is great too. There's just not a lot of differences anyway between the two. And there is a crosswalk right here in the description, so you don't waste time if you have the 7th edition trying to figure out where the information is. Pages 188 through 190 in Billings and Halstead describes the 3 learning domains and helps you have a deeper understanding about the verbs and the learning that's happening for each of the taxonomies for each of the learning domains. Okay, so each of the learning domains have their own taxonomy. We have the cognitive learning domain, we have the psychomotor, and we have the affective learning domain. All right, and then next what you want to consider is the actual exam analysis. So that is on our homepage. That's where you're going to find an opportunity to do, again, a self-assessment based on your knowledge in alignment with exam analysis. Your ability to truly do a deep dive in exploring opportunities to improve the validity and reliability of your exams is an essential step in quality improvement. Also, just helping validate for us that students were actually knowledgeable or not as knowledgeable as we anticipated related to concepts is a key part of our curriculum development improvements that we want to explore. Or maybe it's just integrating more content related to a concept that students still have a lot of muddy points about. So that's what you want to consider next is number 2, an exam analysis self-assessment, and that is on our webpage, okay? And we're going to go ahead and put that in the description as well for this snapshot. And then the third resource for colleagues on the journey for CNE is going to be the NLN self-assessment exam. That is available on NLN's website. You're going to choose the exam you're going to take, okay? Go to that homepage, and then on the left-hand side, you're going to see CNE test prep resources or something to that degree, because sometimes they change the naming on their website. So you're looking for test prep resources. That's where you're going to find the self-assessment exam. I would say 50-50 when it comes to colleagues, whether or not they find that's helpful. However, here's the benefit of the SAE, the one that we hear about the most. Number 1, if you have a lot of test anxiety, the SAE is a great way for you to get some experience with taking a computerized, standardized exam. Number 2 is for those colleagues that really just want to get a sense of where their gap areas are. Now, on that homepage, you're going to see the NLN has a disclaimer. There's no correlation between how you do on the SAE and how you actually do on the CNE exam. However, it's still good information for you to have as it relates to the rationale for those correct answers and incorrect answers on the actual SAE. That's going to help you identify, perhaps, or validate your muddy points, or maybe you thought you were doing well in a certain area and you take the SAE and you figure out that, you know what, even though I got that question correct, I really don't understand the rationale quite deep enough. This is when you're going to go to Billings and Halstead to go deeper to make sure you're closing your knowledge gaps. All right, so let's recap as we close out our time together. Step 1, strategy number 1 is doing a self-assessment, okay? We're talking about being on this journey on the road to success, whether you're taking the CNE, even if you're taking the NCLEX. These are all strategies that could work across any standardized exam that you're taking as a nurse or as a nursing student. So number 1 is going to be using that blueprint, okay, or that test plan to do a self-assessment, being really honest with yourself about where your knowledge gaps are today. For CNE, we're looking for that 70% confidence that you could answer the question correctly related to that concept. If you're not at that level, it's a gap area, okay? And you're going to be on this journey. You could be on a 60 days journey with us, or maybe you're thinking about it. Or you could be a part of our community here or in our monthly boot camp, okay? So whatever community, whatever method of support you decide on, you have options, okay? And then the next resource is going to be exam analysis. So that exam analysis is available for colleagues on the CNE journey on our website. And then that last resource is the NLN's self-assessment exam. All right, so I forgot to read our actual motivational quote and consideration for our time together. This is from our book, Rooted in Wisdom. So I'm going to go ahead and read week 10, day 66. This is about rethinking assessment. This is a really good one. Assessment should be more about learning than about testing. That's by Grant Wiggins. Okay, I'm going to say that again. Assessment should be more about learning than about testing. When we give students exams, it gives us information and it informs the student about the gap areas that they have. We want, as faculty, to come alongside the student to help them close their knowledge gaps. How can we do that? Well, it first starts with that increased awareness. Use informative assessments, as many as appropriate for our classes, to help students discern what they know and that they don't know. And then we want to help them bridge that theory practice gap, clarify any muddy points that they have, before they get to that summative assessment, and ultimately before even they get to the next formative assessment. Okay, so that's what we want to consider. All right, so that's the quote for our segment today. And then our devotional says, assessing students should go beyond grades. It should measure understanding, critical thinking, and growth. When we shift from teaching to the test to truly evaluating learning, we create a richer educational experience, and I totally agree. All right, so this is your action item that you're taking steps on today. You're going to review one of your assessments and consider whether it effectively measures student learning. Okay, again, your one action step that you're taking as a result of our time together today is you're going to review one of your assessments and consider whether it effectively measures student learning. And we know that when we're going on this journey as a nurse educator, we are striving for focusing on continuous quality improvement. How can we get better in the tools that we're using for evaluation, the tools that we're using to get ready for the CNE? Our commitment here at Dr. Sellars Educator is that we support you until you are successful on the CNE exam, until you are successful, no matter how long it takes. We look forward to seeing you in a future snapshot. Reach out to us if you have questions. You can find information on our website about CNE in 60 days. It only takes 60 days of committed study time following a 7-week study plan to achieve that passing score. We look forward to seeing you in a future snapshot. Have a great one, everybody. Take care.